Welcome to COVID-19 Nutritional Care Part 2. Let us now see the role of micronutrients in overcoming the COVID-19 infection. Micronutrients. Vitamins and minerals are essential for the adaptive immunity as they are involved in the cytokine production, lymphocyte differentiation, and proliferation, antibody production and generation of the memory cells as well. They also contribute to the maintenance and development of physical barriers and differentiation of innate cells, production and activity of antimicrobial proteins, phagocytic activities of neutrophils and the macrophages, and regulation of the overall inflammatory response. Vitamins A, C, D, E, vitamin B6, B12 and folate, iron, magnesium and trace elements including zinc, selenium and copper play a pivotal role in disease susceptibility and the maintenance of immune function. Deficiencies or inadequate status in these nutrients may negatively affect the immune system, resulting in decreased resistance against infection. The relationship between vitamin A and infections has been extensively described. In the case of respiratory infections, vitamin A plays a pivotal role due to the involvement in healthy mucus layer formation as well as enhancing antigen non-specific immune response. Histopathological alterations have been described in pulmonary epithelium and parenchyma in subjects with vitamin A deficiency, resulting in impaired respiratory function. Adequate intake of this vitamin should be guaranteed in order to avoid further complications in the case of COVID. Loss of smell or anosmia, that is a classical symptom of COVID-19, can be overcome with the intake of alpha lipoic acid. Alpha lipoic acid is a powerful antioxidant that you can get from rice bran, potato, spinach, broccoli, peas, or 200 milligrams of this supplement can be recommended. The vitamin A requirement during COVID-19 infection is 2000 international units. Vitamin D. Vitamin D deficiency is associated with respiratory tract infections and lung injury. The usage of vitamin D agonists have shown effectiveness in ameliorating the condition. Investigations have demonstrated that high dose supplementation of vitamin D, that is 250,000 to 5 lakh international units per day, is safe and effective in improving the health status of critically ill patients, enhancing the capacity of the blood for oxygen transport and increasing the hemoglobin levels, which resulted in shorter hospital stay. Vitamin D levels are severely low in the aging population, which is the most vulnerable population group for COVID-19. Meeting the recommended dietary allowance for this vitamin would be the best advice. Higher doses of vitamin D are advisable for the vulnerable subjects in order to avoid deficits, especially in situations like the lockdown. RDA for vitamin D is 600 to 800 international units for the active vitamin D3. The good sources include eggs, salmon, red snapper, organ meats, oysters, and for vitamin D2, it is the mushrooms, soya bean, sesame seeds, amaranth seeds, walnuts, ragi, lentils, and pulses. Wake up early and soak in 15 minutes of morning sunlight, which would be the best advice for the people who have been affected with COVID-19. Vitamin E. Vitamin E has been related to the humoral and innate immune function. The ability of vitamin E to scavenge reactive oxygen species plays an important role in oxidative stress reduction, exerting anti-inflammatory effects. Vitamin E also protects the polyunsaturated fatty acids and immune cells from oxidation. Evidence regarding the use and dosage of vitamin E as a prophylactic or the therapeutic agent against COVID-19 is less and not established. Significant research has been conducted over several decades regarding the use of vitamin C as a remedy for colds. Vitamin C intake could act as a prophylactic in COVID-19 infection. 40 milligram is the RDA for a normal adult. Magnesium. Magnesium acts as a cofactor for the immunoglobulin synthesis, which are the immune cells of the body, and it plays a role in immunity and fighting infections such as COVID-19. RDA for magnesium for the adult male and female, it is approximately 310 to 350 milligrams per day. And the good sources of magnesium include ragi and the whole cereals and also the lentils. Iron is a nutrient with diverse implications in COVID-19. It is well known for the correct functioning of the immune system. It is also well established that the iron-containing enzymes are essential for the completion of the virus replication process, particularly the coronavirus. Iron chelation could be an alternative adjuvant strategy to treat COVID-19 patients by manipulating the key iron regulators. Zinc. Zinc is crucial for normal development and function of the immune cells. Deficiency of zinc is associated with immune dysfunctions, which increases the risk of infections like COVID-19. The RDA for zinc for the adult ranges between 10 to 12 milligrams per day. Good sources include lentils, pulses, soybeans, sesame seeds, garden cress seeds or the halum, almonds, walnuts and poultry. And why should we consume zinc during the COVID-19 infection? Increasing the zinc concentration inhibits the replication of the SARS coronavirus. Zinc deficiency is linked with defective cell-mediated immune response and increased susceptibility for various infections. Increased zinc intake may exert beneficial effects on COVID-19 infections by reducing gastrointestinal and lower respiratory symptoms. In addition, it has been suggested that zinc intake of 30 to 50 milligram per day may exert beneficial effect on the RNA virus. Selenium plays an essential role in the immune system due to its anti-inflammatory effect. There is a positive association between higher recovery rate from COVID-19 infection and adequate selenium. The effect is in line with the significant benefits of selenium supplementation demonstrated against other viral infections including HIV, hepatitis B linked liver cancer or epidemic hemorrhagic fever. Food sources of selenium. We find that selenium is rich in Brazil nuts, tuna, halibut, sardines, ham, shrimp, macaroni, beef steaks, and turkey, beef liver, chicken, and cottage cheese. Copper is essential to maintain DNA integrity by preventing oxidative DNA damage. Studies conducted revealed that copper supplementation may ameliorate such inflammation. However, no substantial evidence is available in order to recommend copper supplementation against COVID-19. Let us now have a look into the immune boosting nutrients in COVID-19. Deficiency of single nutrients also results in altered immune responses that is observed when the deficiency state is relatively mild. Of the micronutrients, zinc, selenium, iron, copper, vitamins A, C, E and B and folic acid have important influence on immune responses. Vitamin A is involved in the development of the immune system and plays a regulatory role in the immune processes which can help the body fight COVID-19 infection. Immune booster vitamin A. RDA for vitamin A for the adults is 600 micrograms of retinol or 4800 micrograms of beta carotene. Good sources include carrots, pumpkin, dark green leafy vegetables, chicken, liver, egg, mackerel, and chicken. Combination of any of these three items could be included in the diet of the patients suffering from COVID-19 that would help to achieve the daily requirement of this nutrient. Vitamin C contributes to the immune defense by supporting various cellular functions of the immune system. Its deficiency results in higher susceptibility to infections like COVID-19. RDA for vitamin C for the adult is 40 milligrams. Good sources include amla, guava, orange, capsicum, broccoli, red amaranth, and also lime. Immune booster vitamin E. Vitamin E is a potent antioxidant and has an ability to boost the body's immune functions, especially in the elderly population which are more susceptible to COVID-19. RDA for vitamin E is 7.5 to 10 milligram of the active form, that is alpha tocopherol per day. Good sources include pista, halum or garden cress seeds, almonds, zucchini, spinach, sunflower seeds, and flax seeds. Bioactive compounds also play a vital role in the prevention and convalescence of COVID-19. Bioactive compounds. It has been found that several natural bioactive compounds interact with the ACE2 receptor, which is the gateway for SARS and SARS-CoV-2, and thus regulate the viral infection. Natural bioactive compounds can also reduce the inflammatory response induced by SARS-CoV-2 infection. Taking into account that a great number of patients with COVID-19 present pro-inflammatory cytokine storm which drive to a worse prognosis, these molecules could represent a promising target for immunomodulatory therapies. Phytonutrients. No single food is a superfood and functions alone in the body specifically as an antiviral food to prevent COVID-19. Certain phytonutrients present in foods can boost the immune function to fight infections such as COVID-19 at the DNA and RNA level. It would be advisable to use these herbs in higher frequency in daily cooking, in marinades or tempering, or as a concoction to help boost immunity over time. The Indian spice. Indian Ministry of Ayurveda, Yoga and Naturopathy recommended herbs to be included such as the holy basil, that is tulsi, ginger, turmeric and tinospora at discretion. Anti-COVID-19 foods include ginger, garlic, turmeric, both fresh as well as dry, basil or tulsi, neem and lemongrass. A research study has been conducted to understand the therapeutic potential of resveratrol in COVID-19 associated hemostatic disorders. Resveratrol is a polyphenol belonging to the group of stilbenes naturally found in red wine, berries, grapes, nuts and other foodstuffs. Curcumin present in turmeric is a wonder food. The effects of curcumin on SARS-CoV-2 infection has been addressed by several research groups. As early as 2007, Wen et al. Determined the quantity of spike proteins in cultures of Vero E6 cells infected with SARS-CoV and observed that this compound was able to significantly decrease the virus replication. Probiotics. The gut microbiota is in continuous bidirectional interaction with a host, regulating both adaptive and innate immune system. It has been recently postulated that probiotics can exert protection against viral infection at 3 different levels. That is, providing a stronger innate immune response in the gut, decreasing the gut permeability, regulating the acquired immune response. Probiotics could be proposed as a potential tool to be included in the nutritional treatment of COVID-19 patients that are present in the curd. The potential application of probiotics and prebiotics for the prevention and treatment of COVID-19 and the probiotics helpful for the prevention of COVID-19 were some of the research articles that focus on the role of probiotics in the prevention of COVID-19. Fluids. Water is an essential element for life as it carries nutrients in the blood, regulates body temperature, and flush out the toxins from the body. Drink at least 3 to 4 liters of water every day. Even mild fever is associated with loss of fluid, which can lead to dehydration. For cardiac and kidney patients, the volume of fluid and sodium along with other electrolytes may have to be restricted. Physician will advise on the total fluid intake for a particular patient based upon his or her complications. Plenty of fluids or beverages must be included for the patient who suffers from COVID-19. Buttermilk, soups, coconut water, salted lemon water, and ORS can be used. Consume herbal concoction, coconut water, milk and fresh juice. Avoid packed juice and the fizzy drinks. Avoid tea, coffee and caffeine containing beverages since caffeine tends to increase the heart rate, dehydration and blood pressure. Chronic diseases that are commonly present in patients with COVID-19, mainly diabetes, chronic obstructive pulmonary disease, renal insufficiency, cardiovascular disease or dementia, as well as other risk factors such as socio-economic status or frailty, have negative effect on the nutritional status of these patients. In addition, during hospital stay, the prolonged immobilization, mainly in the long stays in the intensive care units, leads to muscle mass losses, making the recovery of these subjects harder. Therefore, protein energy malnutrition is very much prevalent among these patients. Causes of protein energy malnutrition. Malnutrition is probably due to anorexia, nausea, vomiting and diarrhea, which impair the food intake and absorption. Hypoalbuminemia, hypermetabolism and excessive nitrogen loss can also lead to protein energy malnutrition. These effects are clearly associated with the increase in pro-inflammatory cytokines observed in these patients. Moreover, anorexia can also be related to dysgeusia. Why is PEM very common in COVID-19? In patients positive with COVID-19, 65% had dysgeusia, whereas in patients negative in COVID-19, only 16% had the symptom. 53% were malnourished and 28% at risk of malnutrition and 20% non-malnourished. Furthermore, the need for assisted breathing during prolonged periods also contribute to the development of sarcopenia and malnutrition. Meal frequency and consistency. If the patients have dry cough and sore throat, if it is severe, solid food intake may decrease. Warm, soft foods and supplements can be used. Small, frequent foods would be better if the appetite is less. Timing of fluid consumption should be in between meals and not along with the meal. ICU patients can have swallowing issues called prolonged due to prolonged post-extubation swallowing disorder after discharge. This can last even up to 4 months and must be managed with alternatives. Exercise. Prolonged home stay may lead to reduced regular physical activity and hence a drop in muscle mass. ICU patients suffer the most muscle mass. Once the patient is stable and the physician gives the clearance, exercise must be slowly encouraged as per tolerance. Safe, simple exercise may include strengthening exercise, activities for balance and control, stretching, or a combination of these to maintain fitness, done preferably under guidance. Finally, patients may need support with their mental health as well. Seeking counseling from appropriate trained mental health professionals is also recommended. WHO recommends 150 minutes of moderate intensity or 75 minutes of vigorous intensity physical activity per week. The benefits of such periodic exercise are proven very helpful, especially in times of anxiety, crisis, and fear. To safeguard ourselves from this infectious disease, follow the safety protocol of staying at home, wearing mask, and sanitizing the hand. COVID-19 Nutritional Care Part 2 provided us an overview of the role of micronutrients pertaining to vitamins and minerals, prevention of COVID-19 through the usage of immune boosting nutrients, the role of bioactive compounds and fluid management, ways to overcome protein energy malnutrition associated with COVID-19 infection, and also about the importance of physical exercise during convalescence. Thank you.